Okay, so I want to start with a few pearls based on my kind of ups and downs with aesthetic practice. So I want to start with social media because tonight we're really focusing on the younger patients. Social media, as we mentioned earlier, has really become the key marketing platform for pretty much all aspects of medicine, clinical, aesthetics, to regenerative, and even surgical. That's because we're online. We're online majority of our time, even when we're working. So people always have their phone out. Younger people, younger patients will even show up to your office, say, I found you on social media. Sometimes that can be intimidating because, sometimes you wonder if they're also finding other physicians or providers that may not be as qualified just based on social media presence. So it's important to build your social media. That's how you're going to get patients into your door, especially the younger patients. But at the same time, it's important to maintain authenticity. And what I found interesting is that what you project on social media is what you attract to your clinical practice. So if you post a lot of before and after of lip filler, I can guarantee you a lot of patients are coming in asking for lip filler. And if you post a lot about jawline contouring, yes, that's the patient you'll be getting. And if you post a lot about threads, you may watch out. You're probably gonna get some thread patients, which is not my favorite type of procedure. So always be mindful of what you're posting on social media. And being authentic also means that sometimes you need to add a little bit of fun, add a little bit of personality. Don't just post boring stuff or clinical stuff. Make some personal, like I would say, what you're interested in. Maybe add a little bit fashion just to make it fun, but stay professional. And it's important to be patient with social media. It takes time. You need to build your digital assets. You need to start taking pictures. You need to standardize your photos. And very important to always ask for permission. And also want to caution against trading social media come permission for service. That's just like a very slippery slope. I never offer discounts to patients just because they may say yes to social media. You just don't want to get into that gray zone. It's not, to me, it's not ethical. And also it may endanger your relationship with that patient in the future, make it too sticky. And there's some minor interesting differences between Gen Z versus millennials. I find a lot of my Gen Z patients walking through a door knowing exactly what they want. So they may come in, I want my jawline contoured, versus my millennial patients. They may come in and say, I want some Botox, but I just don't, I'm scared to do Botox, or I want some lips, I want to look fresher, but I don't know what to do. So just to kind of be prepared to know that they do have some generational differences. For some practitioner, it's great when patients know what they want, but at the same time, if what they're asking doesn't necessarily fit with their facial feature, you need to be ready to say no and explain to the patients why you don't think that's the most appropriate procedure. For example, a lot of Gen Z patients coming wanting a thread lift for the eyebrow, for the snatched eyebrow look. I now have to take a little time to explain to them why that's not practical or safe. Versus the millennial patients, they want a long-term rejuvenation plan. What I have found in my practice is that a lot of patients come into me like say, oh, I used to go to her, I used to go to him, but or that person never tells me what to do next. I have to come up with my idea. So a lot of times they want guidance. I want to ask my colleagues, what do you guys think, Dr. Ibrahim and Dr. Lawrence? Have you seen similar differences in the Gen Z versus millennial patients?
Yeah, I would say in my experience with my patients, I practice in downtown Chicago, and one thing about downtown Chicago is very young. Soon, what someone has their first kid, they're already planning their exit from downtown Chicago. Once they have that second kid, they're out to the burbs. So I get most of my patients are millennials. I do have some Gen Z patients as well. I agree with I always credit the Kardashians for allowing me to have a job, because without them, really, I think social media and I think like mainstream media is a double-edged sword. Why? It's because, I mean, it's made these procedures ubiquitous. So it's made it more commonplace. I mean, you used to, 5, even 6 years ago, you never saw celebrities on reality TV talking about their Botox appointment or their filler appointment. So the more transparent people are out there, the better for all of us, because patients are coming in requesting things. However, the double-edged sword is true. These patients come in, I would say Gen Zers more than millennials, but both cohorts, I would say. They come in, they want the sort of the filtered look, as you said. They want the immediate satisfaction. They want immediate transformation, but it's really important to take a step back and look at, okay, what does the evidence show? There are many studies that show that younger patients, first of all, millennial patients have huge buying power that's only going to increase as their, positions in their jobs, as their spending power, I should say, is going to increase. And so these are patients that we are hopefully going to be growing with. And another thing that the studies have shown is that, hey, regardless of that 1 or 2 patients that come in, they're saying, I want to look like XYZ. Most patients at the end of the day still, they still prioritize subtle results, longevity, and safety. And so this is over all ages. So I just want to stress that, yeah, you're going to get these patients that want dramatic transformations and things like that. But the overall majority of the patients are still nervous, still need hand holding. They still expect your expertise, and they still want to look natural. And you have to remember the cardinal rules that apply to patients of all ages.
Excellent. Totally agree. And what about you, Dr. Lorenz? You see a slightly different population in New York, a different, maybe different aesthetic ideals, because I do notice differences between Miami patients and New York patients.
Well, I agree with you. I think younger patients, Gen Z patients, live on their phones and on social media, and they do come in with a preconceived notion of what they think could be done. And of course, half of that is fantasy, because half of that is filter. And you made a point before about being authentic. And I think that's the most important thing, because ultimately you are responsible for the care that you provide. So stay authentic, make them realize what reality is. And again, I deal with that every day, because I have a 23-year-old daughter that thinks that this can happen, that can happen. So we have to be careful. And ultimately, it's about safety for the patient. And as long as, I still see it across the board, across all ages, is that ultimately patients trust you. If they come to you, obviously, I tell them to put their trust in me or don't come to me. It's very simple, because ultimately you're responsible for it. It's a very complex scenario and a landscape right now. It's so different than when I started my practice. And you have to adapt and work within the parameters, but still stay true to your training and to your convictions.
Absolutely. Now, I do want to spend just a few extra minutes talking about patient retention, because that's sort of like, the holy grail of building a successful cosmetic or aesthetic practice. You want to retain patients, you want to grow your patients, and you want patients to refer patients to you. And one of the challenges I'm sure we have already experienced is that younger patients may not be as loyal. They like to shop around. They like to look for the best deal. But I want to say that it's actually possible to retain younger patients. So, for example, I find very helpful to always ask patients to come back for a follow-up, no matter how small the initial investment is. For example, they just want a little bit of brow Botox. That's 4 units total, not much a big deal. You may think it's a waste of your time. But if you bring that patient back in a couple of weeks, she looks better, or he looks better. And a lot of times they come say, oh, what do you think about this? What do you think of my cheek? What do you think of my lips? What can I do for my skincare? So that builds relationship. And secondly, it's important to take the photos because a lot of times we have this perception drift, which is that over time we forget how we looked before. So they may not realize that the improvement you gave them in the brow shape, in the crow's feet, were real because they forget how they looked before the procedure. It's important to show them the photos. And I like to spend time with my patients, even though sometimes it may be a waste of time, but majority of in circumstances ends up paying off. I spend time focusing on debunking myths, tell them what's real, what's not real, tell them about the alternatives, and always be available to patients when they have questions after the procedure. So I like to give out my cell phone. I know this sounds very strange, very dangerous, but trust me, most patients don't abuse that. They treat it as a special privilege. And very rarely I have caught like instances where like it's a bad bruising, I can bring patient back for laser the next day. And that really improves patient satisfaction and help you to retain patients. And of course, if you're not really want to do like a heavy cosmetic practice, this is probably not going to be rewarding for you. So definitely before you go on this route, you need to decide for yourself, do I really want to focus on aesthetics? Because aesthetics is not easy. And of course, when in doubt, say no. I just want to share a few like case studies. So this young lady, she's a Gen Z. She's like in her early, I think she was like 22 when she came to me earlier this year. She came in walking out the door. I want under eye filler because I'm always tired. I want lip filler, but I don't want big lips. So within like a few seconds, like literally, like I want to tell, let me tell you about the complication. No, I know what I want. I saw your social media. This is what I want. So right away, instead of like starting with baby Botox, we started with a tear trough filler. We started with lip filler. This is her before and after, right after the procedure. She was happy. And I said, you know what, come back in 3 months because you do have this deep tear trough area. You may need a second session. She came back 3 months. She actually looked amazing. Her infraorbital hollow is like almost very minimally noticeable. But she did realize she wanted more lips. So we did more lips. So this is conversion by following patients up. Because I never thought she wanted a second session, but she did. And she looked great in it. And that was feasible. That was still within reason. So conversion from having patients coming back to follow up with you. This is another example of giving patient suggestions when you first meet them. When she first came to me, she just wants some gummy smile Botox and then some upper face. We did that. And I said, you know what, like you're super young, you have a really good volume, you have like great skin, we can do X and Y and Z. So I gave her a plan. She took the plan, like, of course, like she came back and 4 months later, she followed up with her Botox and started doing some master slimming. And then we started doing some tear trough. And then we started doing a little bit lid filler, a little bit chin. So gradually over the course of like a year or so, we pretty much treated her entire face, but without really changing her look, just harmonized her lower face, gave her a little bit better proportion. But this is another example of conversion after you gave patient a thorough discussion what the treatment plan can look like. This is her, again, like before she started the journey and then current how she looks. And then this is another example of a millennial patient came in just wanting to have lip filler. And of course, when you look at her anatomy, she has a little bit receded chin and she has some sun damage and she has a very fair skin. So we talk about skincare. So after initial lip filler, we did a little bit IPL, we did a little bit microneedling, and then we start adding because she felt a little bit more confident and she realized she needed a chin. So we did a few sessions of the chin and a little bit more lips. So again, example of how you can retain younger patients by having them coming back to you for follow-ups and giving them suggestions and recommendations, and while still maintaining a natural outlook. And then when you have patients following you for multiple years, it's really satisfying because then you can see how modal approach can give that, the Benjamin Button reverse aging effect. This is when she started with me 3 years ago or 4 years ago. Just over time, by showing photos like this, really motivates patients. They're like, oh, wow. Like, they feel good about spending the money. They feel good about treating themselves. And it also helps them have more confidence, So this is why we love what we do. And when you have the right patients, when you choose the right procedure, is very satisfying. And lastly, less is more. I mean, when you have patients like her, like she barely needed anything, but she just wants to look better. So we use 2 ml. Like, she wanted to do a lot more than she needed. So I talked her out of it. We just did a little bit cheeks, a little bit pure from fossa. We did teeny bit upper lip and chin with 2 ml. So this is where you really have to just resist the urge, even though the patient has the means, they have the desire to do a lot more. You do like less, you do just enough, and they come back to you because they don't look done. So these are the pearls. I mean, I want to ask my panelists, do you guys have any other pearls that you'd like to share with the audience before we go to Q&A?
I agree with everything that you had discussed. I mean, all my first timers, I tell the patient, this is all my first timers, whether it's Botox or filler, whatever it may be, I have to see you back 2 weeks later. And so just by doing that extra step really helps separate you from the Botox mill down the street.
Mm-hmm.
And so that is number one. Number two, I really want to belabor the point, do not undersell yourself. So don't try. I mean, I have an entire other lecture on sort of pricing your cosmetic procedures and how to price them. But basically, you want to make sure that you are priced high enough that you are considering yourself a luxury, not a commodity. But of course, you don't want to be too high where you drive people out the door. And you want to know what the general sort of market price is around a millennial patient. And especially for me, I've been in practice for just 5 years, my first few years, and it takes years to get over that sort of pain of charging a millennial or a Gen Zer, and you're like, oh, let me just give them a 20% discount. You just want to give them that discount because you feel for them. But what you have to realize is you can't discount yourself. You can't undersell your talents and undersell your abilities just to keep up with a patient that comes in and says, well, the Botox is $12 a unit down the street. Why are you 14? Why are you 16? It is what it is. I'm not haggling. These are our prices. And you give a comprehensive evidence-based sort of consultation, and they're with you for life. And they forget about that $12 that's down the street.
Absolutely. I totally agree with that. Don't undersell yourself.
Well, I think it's important because, if you do that, you never can go back the other way. And, I learned a lesson many years ago in 2008, I used to go to a resort in Montego Bay, and this resort charged regular prices when everybody was cutting it 50%. And the manager said to me, when it comes back, I'm going to be on the top. And it's true. So once you go and you start discounting yourself, it is demeaning, and it's not right for the patient. They're not paying for the 2 cc's of HA that you've injected. They're paying for the 20 years that it took you to get to that point that you're an expert at it. So I am a big proponent of charging for your expertise, not for the product.
Right, absolutely. And it's the follow-up care, it's the comprehensive plan that you give them, like the 2-year plan, 5-year plan that takes expertise and experience to develop and customize. Okay, let's go through some questions. So first questions for tear trough and infraorbital, what fillers and what size cannula? With cannula treating tear trough, can you place filler right above periosteum, or are you higher up? So I would like have all three of us answer this question. I will start with my preference. So for the infraorbital area, I used to love Belotero, but then it just didn't last long enough. So I switched to Restylane, and then now I'm using almost exclusively Refine, very rarely Volbella. Sometimes I'll hydrate the Refine or hydrate Restylane, but most time I prefer Refine. I use 27 cannula, but keep in mind 27 micro cannula can pierce a vessel. So don't have that as your security blanket. Cannula does not equal safety when it comes to working around key vasculature. And when I was trained to do infraorbital hollow, I was told to place right above the periosteum under the muscle. But really, I think in reality, and also now we have learned to avoid that permanent swelling or long-term swelling, we should place above the muscle, subdermally. And it's about the quantity. So be careful about the volume you're injecting. Smaller volume, safer, and better long-term result. I'd like to hear my colleagues. What are your thoughts on this?
I use for the tear troughs and infraorbital. I do use cannula. I use a 25 gauge, precisely because 27 gauge can pierce almost as easily as a needle can, but it just depends on preference. And I actually place it on both, sort of mostly, I think, the periosteum, like right above bone, because I mean, you're not scraping the bone, but you can sort of feel when you're in deeper, sort of underneath the muscle. And then I do a very, very superficial layer superficially. So, because I've seen it done lots of ways, whether people are in the dermal layer, below the bone, or some combination of both. And that's also been published as well.
Right.
But when it comes to the type of fillers, I pretty much, for the most part, use Restylane, so the plain Restylane, for a couple of reasons. Number one, it's been around for a while, and it's not as stiff, I would say, as other fillers. And hopefully down the line, it will be getting an FDA indication for the tear trough. So that's another selling point for patient. Be like, this is FDA approved. And they're like, okay, great. I sometimes, patients with really, really thin skin, or if I'm just in the mood, I'll just use Belotero. It doesn't last as long, but I really love the fact that it doesn't last as long. Tear troughs, when patients are on my schedule, even a year, 2 years later, they're coming in for a tear trough touch-up. I mean, my heart rate goes up a little bit, because redoing tear troughs yearly or even 2 years is not necessary most of the time, because filler under the eyes can last 5 to even sometimes up to 10 years.
Absolutely.
And so patients are constantly shocked when I tell them that. So Belotero's short-lived experience in the tear trough is actually a very big positive for me personally. And so I don't know, for someone with a very thin frame that needs very little bit, I do Belotero. If they come back 9 months later and it's completely gone, I'm happy. I'm like, yeah, let's do it. It's like changing your oil. It's just like, let's start fresh. That's just my personal experience.
No, I totally like that.
So I use Restylane, but I mix it 1-to-1 with 1% lidocaine. And there are obviously physiochemical reasons why I do that. Less Tyndall effect, less nodularity, so to speak. I use, half the time I use a 27 gauge 1-inch cannula or 30 gauge half-inch needle, depending on the phase of the moon, because I really don't think it matters, because you can get the same result depending on, it's all about the delivery. Steve Fagan many years ago said to me, it's not how you deliver it, it's where you deliver it.
Yes.
And I totally agree with what you said before, that you can't be sort of deceived into the concept of security of using a cannula. You can puncture a vessel. And the other thing is vascular compromise can be a pressure phenomenon, not necessarily an intra-articular injection. But basically mixed 1-to-1 Restylane seems to work very well. And I get typically about a little bit over a year as far as duration from that.
Okay, next question. Why don't you like doing threads? I just want to say I have threads. part of various services I offer to patient, but that's usually reserved for the very special patient. Number one, it's irreversible. You can't really take out threads. I don't care what you say. Some people say you can laser it, you can inject in a little more saline, you can put a little Kenalog, you can put a little bit 5FU if you ever get into trouble. No, that's just not very, very challenging. So it's like once you insert that thread, the delivery tip is there's no point of return. And it's very difficult to manage post-thread care because patient oftentimes, especially if you do like 18 gauge screw or 18 gauge cone PDO threads, they will have pain, they will have some swelling, they will have some bruising. They may have some residual neuropraxia, which is like damage to the nerve ending that may take a few weeks to recover. Not like a irreversible adverse result, but it just takes a lot of hand holding. And then let's face it, threads don't last that long. I would say in the best scenario, the effect you get from threads, especially the PDO threads, maybe 6 to 8 months. Even the Solar West threads I have seen, they don't last nearly as long as they advertise, unless they combine with other like biostimulator filler. But then now we're talking about multiple treatment combined, not necessarily results from one a single treatment. And then thirdly, threads are difficult in the sense a lot of times they may end up getting little nodules. Just depends on the depth of placement. So you have to be very confident, very experienced, tell patient what to expect, tell patient there may be issues that can take time, will take time to resolve that you can reverse. And then if they still want to do it, go ahead and do it.
Well, as far as threads, I think the problem is that patients tend to be deceived into through advertising, I guess,
Yes.
to believe that this is a great solution. The problem with threads is that they don't have the surface area to provide the lift. So to me, this is purely a biostimulatory application of an agent that causes a subclinical inflammation as it is being degraded. It's basically injecting PLLA, but this is polydioxanone. So I'm not deceived into believe, and I've used threads on the forehead, on the trying to get a brow lift. It lasts maybe 2 weeks, 3 weeks. So it's
Right.
not fair to the patient. But I think in terms of a biostimulator, it's an injectable filler. I guess I think of it in terms of it being a placed filler through a placement of a suture.
Right. I do like the smooth mono threads for biostimulatory effect. So we're really talking about the thicker threads that most people come in asking for the thread lifts.
Yeah, but they don't have the surface area to grab on and the holding forces like some of the other products that are on the market right now.
Right. What laser do you use for bad bruising the next day, Dr. Ibrahim?
I use, you can use either the pulse dye, the PDL, the 595, or the KTP laser, which is the 532 nanometer. And the thing you have to remember is you want to use low energies for example, the pulse dye laser settings, you could do 7 millijoules, 10 milliseconds, and 10 millimeter. So 7 millijoules the energy, 10 milliseconds pulse duration, 10 millimeter spot size. Another one for the KTP, the 532, I used 10 millimeter spot size, 6 millijoules, and 6 to 10 millisecond in terms of pulse duration. But really, just low energies, you can do it that same day.
Mm-hmm.
It actually helps that same day, but the optimal results for the bruising is 24 to 48 hours afterwards. And if it's a super, super dark bruise, this is one sort of pitfall that I hit, and it was actually published on like 2 years later, is in the Derm Surge. If the bruise is super purple and super dark, stick with low energies and do only one pass. Yes. I had a patient that had, for the most part, if it's like a lighter, pink purple bruise, I could do 2 passes, not a problem. But this patient had hyperdilute Radiesse on her arms, treated for, biostimulatory purposes for skin tightening. She had a super dark purple, almost black bruise. I did 2 passes and she came back like 3 days later with a blister. And so, lesson learned, the darker the bruise, 1 pass, low energy.
That's a great tip. It happened to me once too. So you'll never forget that once it happens. Yeah. Okay. How do you treat the gummy smile in this patient? Where did you inject the Botox and how many units? I think maybe referring to one of the slides I show. I think gummy smile is difficult to treat. Anywhere from, I would say, when we're talking about Botox, I like to inject at least 2 to 4 units per side. And sometimes patients need more. And honestly, you really have to ask the patient to smile, see where the muscle's pulling, and then determine where you're going to inject. And then, of course, again, less is more. So I always bring patients back and do a little touch-up needed. And then we'll have a couple more. We'll just have like 5 more minutes. We need to go through a couple more questions. Radiesse seems like a more cost-effective option for jawline contour, as 1 syringe seems to be as effective as several syringes of HA filler. Has that been your experience? Any downside of using Radiesse?
So I could speak to this because I use a lot of Radiesse and I do a lot of jawlines. So for sure, I mean, in this patient, for example, here, now that we have her up, just in case, for example, if she were to come in and say, you know what, I want some jawline filler, I would definitely not use Radiesse on her. Number one, very slim, unforgiving. That's one of the negatives. Radiesse, right, especially where if you don't premix it, it's not very forgiving. But someone such as myself who has already, a big frame, someone who has nice thick skin, African American, Asian patients, Latinx patients, they tend to have thicker skin that needs higher lift. Absolutely agree with you. Radiesse is cost effective, long lasting. Negatives are, if you're not very comfortable with it, use cannula, safer than using needle, especially in areas, especially over the antegonial notch, for example, where there's blood vessels, number one. Number two, in comparison to HAs, it's more prone to nodule formation, which I even myself have nodules in my own jawline, which I mostly tell patients, if you feel it, leave it alone, it always goes away, nothing to worry about. If you see it, we have to treat it and we should treat it. But because of the nodules, I mainly use Radiesse from literally the antegonial notch or the beginning or the end of the jowl, posterior end of the jowl backwards. I don't like Radiesse much at all, really, in the pre-jowl sulcus because it gets really clumpy, no matter how thick no matter how thick the skin is or how large the facial structure is. In my seasoned patients, I will use it in the chin quite a bit because, again, bigger bang for your buck, and you get more per syringe, and you get longevity with it as well, and the biostimulatory properties. But just take into account how thick their skin is, their facial frame already, their gender, and the area of the actual jawline that you're treating. I would not treat the anterior jawline with it. That's just my personal experience.
Right, great pearls. And I do also just want to add, in addition to your pearls, is that Radiesse can be a little bit more inflammatory. So don't be worried if patients come in with, inflammation, like swelling, redness, and tenderness lasting longer than your typical HA procedure. I just think that's part of the Radiesse inflammatory effect on the skin, on this at the cellular level. So that's normal, not necessarily adverse reaction, but just expected recovery from Radiesse. Dr. Lorenz, do you have any pearls and tips on jawline and whether you like to use Radiesse?
I love to use Radiesse for the jawline, but I've used every product, right? The Restylane Lift, Voluma, Radiesse is my go-to for the mandibular angle. I think it makes sense. To me, it's a subcutaneous injection with a cannula, unlike a 22 gauge 50 millimeter typically cannula. You can reach everything from one insertion point just posterior to the jowl. And I think it's a subcutaneous injection because of what you mentioned, Omar, as far as the facial artery and the antegonial notch. So stay away from that. I think it's a very good product. And I like Radius because it's a very versatile product, all the way from straight, which with one of the highest G primes, 1400 pascals, to hyperdilute 1 to 3, let's say, or 3 to 1. And you can just take the whole, do the whole spectrum. And that's one of the products, one of the reasons that I like Radius. But again, I alter most of my products, most of the fillers that I use. I customize them in many different ways, including adding toxins to it, but that's sort of postgraduate level of injection.
Okay, very quickly, just have 2 more questions, 4 more minutes. Any good treatments for horizontal necklace or necklines? So that usually refers to the hereditary necklines. I typically try to tell patients this is very normal. We all have them. I like to combine with platysmal Botox and some HA filler. And then we can add a little bit hypodiluted sculpture to treat the skin texture. But honestly, this requires like combination therapy. Sometimes I will add a little bit microneedling radio frequency, but don't expect these lines to be completely erased. They will get better when you do combination therapy, but they will never be gone completely. And
yeah,
then
HA filler for the horizontal lines.
Right.
I tried RHA2. It was too lumpy, and that was the case with a few people that I've spoken to. I then went back to Refine, still a little lumpy and ropey, but it works. You can dilute the Refine with some saline, that smooths it out. Belotero is amazing, but in this area, you really want it to last. One thing I started to use with pretty good result is RHA's Redensity. That's their equivalent to RHA1. It's much finer than RHA2. Can go very superficially. It's almost, and it has the line. It looks like Belotero, but lasts much longer than Belotero. So I really like Redensity in that area.
Agree. I typically use hydrated Refine or Volbella, but Redensity is also a great option. Lastly, how could I watch Dr. Ibrahim's lecture on pricing cosmetic treatments?
So I've given it at lectures. If you email at conferences, if you email sort of the Live Derm, I'm happy to record it and have it either published or a part of another cosmetic or another session. More than happy to. But yeah, just demand it and I'll supply.
Perfect. I love it.
Also, there is, I don't know if you'll see it in the chat, there is one really good question for Paul before we
I
go.
missed that. I'm so sorry.
If you look at the chat, there's one about filling the piriform fossa, which I think is extremely important because it's a very high risk area, but when done well, it's a game changer. So I'm going to. So, question.
I saw the question. I think, you know, the reason why it's challenging, and it goes back to anatomy, right? We know that the course of the vessels varies from left to right and up and down. It doesn't vary depth-wise. So it doesn't vary in the z-axis. So if you believe anatomy, that injection should be right on bone and right at the piriform. And I believe that part of that injection goes into the deep medial cheek fat pad compartment. And that's the reason that you have an effect that's direct at the piriform, which is the first place really where you have this involution of bone. And again, mostly in women because of hormonal changes. But it also extends to the tear trough. And that's the most amazing. And it reminds me of the article that Joel and Rod published in PRS, where they injected 10 in a cadaver, 10 cc's right into the piriform, and it just changed the whole midface. And that convinced me, that was from, I think, 08 in PRS. That convinced me that that's the most cost-efficient injection is in the piriform because it has this direct and indirect. I like to use something like Restylane Lift in that area. I've used Sculptra, depending on what I'm trying to do. Radius is also a good injection product for that area. Or even Luma is fine too.
Perfect. I like to do deep periosteum But always like I'm like sweating when I'm doing the Puriform Boss. No matter what, I'm like, you have to always wash the skin, inject very slowly, very slowly. I try to limit to no more than 0.2 or 0.3 ml, just because a lot of times you may not be near the vessel, but if you inject enough, it can compress the vessel. And okay, great. Really thank you everyone for joining us. I like to thank my panelists and thank Liv Derm for organizing this wonderful session. I hope you guys have a great evening and happy holidays.
Happy holidays.
Yeah, all the best.
Bye.